So I'm really happy, and it is a pleasure to talk to you today about my most favorite topic, acute diarrhea in dogs. And it's an honor also to address here the new ENOVAT guidelines that we designed about the usage of antimicrobials in acute diarrhea. So yeah, it's a pleasure, and I'm really happy to be here today. I have neither financial nor personal disclosures here related to the topic covered in the talk. And as Jan told you, I'm on your side because I'm a clinician, and I know that diarrhea happens all the time in our patients. So I think diarrhea in dogs is one of the most seen diseases in many kind of variations that we see every day in our practice and in our clinic, and we need and we want to react and give the owners something to treat that. So I think this is a really important topic for us as practitioners. And first of all, when it comes to acute diarrhea, I think it's important for us to understand the disease and understand the dogs and the patients behind it. So as I said, this is a common cause, and sometimes, you know, okay, there was maybe a dietary indiscretion as the cause for the disease, or sometimes there are some toxins, but most of the time, the etiology is not really understood, and you don't really find out what the cause for the diarrhea was. And the clinical signs, they are classic, I think: loose, watery stools, increased frequency, which can be problematic for the owners, and you can also have potential blood and mucus in the stool. And what is the good thing is that acute diarrhea in most dogs is mild, and in most dogs this is self-limiting. So in most dogs this may go away anyway. And our general approach should be to support the patient in the disease, maybe make dietary adjustments, and potentially identify, treat some causes. And what is extremely important is that we should not lead to any harm through our treatments for the acute diarrhea, which leads me to one of the treatment strategies that were used over decades in these dogs in clinical practices. So here you can see two pictures from one study that was published years ago, where you can see how many patients with acute diarrhea were treated with antimicrobials. And on the left, you can see that dogs with non-hemorrhagic diarrhea were treated in around 50 or more than 50% of cases with antimicrobials. And especially when the dogs had hemorrhagic diarrhea, they were treated even more often, around 70 to 80% of the cases. And which antibiotics were used in practice? You all know them. Metronidazole is one of them, and also beta-lactams were used often. The good thing is we are getting better in this. Here is one study from October of this year, so a really new trial, where they asked in the UK the practitioners how often and when they prescribe antibiotics in acute diarrhea. And today it's only prescribed in 40% of the cases. So this is, to be honest, also a very huge number, and something we had the feeling to address and to educate practitioners about indications of antimicrobials in acute diarrhea. This is a survey where practitioners were asked in different countries of Europe about their indications, so when they use antimicrobials in acute diarrhea. And you see huge differences in the survey between countries. So here are examples of Sweden and an example of where I'm coming from, Germany and Austria. And on the right, on this picture of Sweden, you can see that the practitioners there almost never use antimicrobials in acute diarrhea in dogs. This is because they are strictly regulated in when they can use antimicrobials in these patients. But more important is they almost never use antimicrobials, but they do not see a higher mortality of these patients. So they are getting better without using them. And on the left, you can see the picture of the practitioners in Germany and Austria. And what I can see there is that there maybe is a huge confusion about the topic, because you can see, for example, 35% of the practitioners using antimicrobials every time when there is blood in the stools. And after my presentation, you will learn that this is maybe critical and we should not do that. So, yeah, I think the last slides demonstrated why it's important to give some guidelines for the use of antimicrobials in acute diarrhea. And moreover, usage of antimicrobials is a global health concern, I think. So the WHO has declared that antimicrobial resistance is one of the top 10 global public health threats facing us humans. And misuse and overuse of antimicrobials are the main drivers in the development of drug-resistant pathogens. And drug-resistant pathogens are a problem for us as humans and also for our animals, because when there is a circumstance that we need to treat a bacterial infection caused by a drug-resistant pathogen, then our treatment can be less effective and we have prolonged illness and higher costs, increased mortality. So an overuse or misuse is something that we should not do in our dogs. So here the ENOVAT, the European Network for Optimization of Veterinary Antimicrobial Treatment, comes into the play. And one of the goals of the ENOVAT is to balance treatments that we need for our patients, balance this against resistance that we might trigger with overtreating patients with antimicrobials. So ENOVAT goals and tailored antimicrobial therapy. The Innovat consortium is a huge group of people. So we are over 250 people from over 45 countries, and the Innovat is organized in 5 different working groups. And one of the working group, which is the working group 4, focus on European treatment guidelines. And there will be guidelines in the next couple of years published on different animal species and on different diseases. And one of these diseases is the canine acute diarrhea. And here I want to present us, the panel of people that designed the guidelines. So we are a huge group. Most of us are coming from the clinical field, clinicians and practitioners, specialists in internal medicine, gastroenterology, and also we have some general practitioners in our group, because this should be a clinically relevant guideline document. And we also have specialists from nutrition in our panel, and some people from microbiology, pharmacology, public health, and epidemiology in our group of our panel. So I think this should make clear why it is necessary to put up the guidelines and how we are, who we are. But besides of presenting you the antimicrobial guidelines, I want to guide you through the whole disease complex of canine acute diarrhea. So I want to give you some insights on how you should maybe assess the disease. I want to give you some examples of diagnostic tests that are possible and some that are necessary in these patients. And in the end, I want to give you an overview about the treatment strategies, about the antimicrobials, and also 1 to 2 slides about other treatment strategies in these patients. So first of all, I want to go through the assessment of the acute diarrhea in these dogs. So when I have a dog with acute diarrhea, the first question I ask myself and also ask the owner, is this really acute diarrhea? Or is this maybe an acute flare-up of a chronic disease? Because it is also something that you can see. And when you have a patient that has a chronic enteropathy, you must manage them differently from the ones with acute diarrhea. Then the second question I would ask myself is, are there any hints indicating an extraintestinal cause of the diarrhea? For example, something like uremia, liver function abnormalities, or Addison's disease. And third, I ask myself, how can I describe the severity of the disease in this dog? And this is also a very important question, because I also base my treatment strategy on a dog base them on the severity of the disease in the individual dog. First of all, is this really acute diarrhea? So this is easy. Acute diarrhea is defined as diarrhea for less than 7 days. But in some patients is, to be honest, not that easy, because sometimes, as I told you, we have a chronic disease in dogs, and owners think that this is acute because it's an acute flare-up of a chronic disease. So for example, in some owners, it's normal that their dog is defecating 8 to 9 times a day for years, and they think this is normal, and then present the dog in your practice when there is really diarrhea present, and then they say, okay, this is acute. But when you ask questions about the history of the patient, you find out that maybe there is a chronic evidence, and then you have to manage them in another way. Also, prior lab work can help you to distinguish chronic from acute diseases. If you have a protein loss, a long-term protein loss over the intestines, that might help and lead more to a chronic disease way. When you have measured cobalamin beforehand and this was low, this is something that we can see in chronic diseases, not in acute ones. And for example, also the dysbiosis index is more abnormal in the dogs with chronic diseases and not in the acute ones. So all these things can help to distinguish. And when I'm really sure that this is an acute diarrhea event, I search for indicators for an extraintestinal cause for the diarrhea. So sometimes the diarrhea is not the most important problem of the dog, but only an effect of another extraintestinal cause. And here you can see examples on which I looked at my patients to find out if there is another disease, underlying disease that can cause the diarrhea, something like nephropathy, liver function abnormality, neoplasia, etc. So there are a bunch of things there. Then when I ruled out extraintestinal causes, and besides of the clinical indications of extraintestinal causes, also lab work can help there. But when I ruled out them, then I can ask myself, how can I describe the severity of the disease? And this is also something that we use in the ENOVAT guidelines to lead antimicrobial usage in these patients. In dogs with acute diarrhea, we can subgroup these ones in dogs that we see that have mild disease, here on the left, then dogs that are moderately affected by the disease, and dogs that are severely affected by the disease. And here I don't mean the severity of the diarrhea, I mean how severely the whole individual is affected by the diarrhea. What means mild disease? The first group. So these are the typical dogs with acute uncomplicated diarrhea that can treat it as outpatients. They are bright and responsive. They are stable in their cardiovascular status, no tachycardia, no tachypnea, blood pressure stable, etc. And they have no clinical signs of dehydration and hypovolemia, so you can send them home with symptomatic treatment alone. And they have no fever at all. Then what do I mean with patients with a moderate disease? So here in this subgroup, you can find, for example, dogs with acute hemorrhagic diarrhea syndrome. These dogs can be depressed, and these dogs can have severe dehydration. So they can have clinically detectable hypovolemia, they are tachycardic, tachypneic, they are dehydrated, but most of these dogs respond well to fluid therapy, and then their clinical symptoms, like for example tachycardia, etc., disappeared. And also in this group, the dogs should not have fever. From different retrospective studies, this is very interesting, we saw that fever is something that you almost never see in most of the dogs with acute diarrhea. So when a dog with acute diarrhea has fever, I would say, okay, this is a dog that may be potentially a real severe problem. So these dogs are in the severely diseased group. And also in the severely diseased group, you find the patients that are presented with severe dehydration and hypovolemia, but do not respond appropriately to fluid therapy. They stay clinically unstable, they stay depressed, they stay tachycardic, tachypneic, also when you give them the fluids that they lost over the diarrhea back. And now you can think about how often do you see these patients that are severely diseased, and how often do you see the dogs that have only mild disease? And I think you all have a feeling about that also hopefully fit with what the studies say. So these numbers that I can present you here now are the numbers from retrospective studies where it was found out that most of the time we can see in practice the dogs that are mildly affected. So 84% of our dogs are only mildly affected by the disease. And severely affected dogs, these are the rare ones. So only 1% of the dogs with acute diarrhea are severely affected by the disease, and most of them are mild, uncomplicated, etc. And one other important point is that the severity of disease is not based on the blood admixture in the diarrhea. So it does not depend for me if there is blood in the stool or not, in which group I would put a patient in. And also blood in the stool does not lead me to any treatment decisions. Okay, so it's more the severity of the disease that lead me to the decision how to treat the patient and if I need antimicrobials or not. Then after assessing the patients, I'm coming to the diagnostic workup. So this is also something that I base on the severity of the disease. Also, I take more care about the puppies. So the age of the patient is also something I take into consideration when I think about what diagnostic steps should I go. And also something like, for example, other comorbidities can lead to a different diagnostic workup. And for the mildly diseased dogs, for sure, sometimes only clinical exam and a rectal is enough. Potential add-ons that you can add in the dogs that are moderately to severely affected, or in dogs that have maybe other comorbidities or other things, can you see here? So one thing that we can add is a blood work. We can start with a PCV, which helps to assess also the dehydration or the hydration status of the patient and the total solids as well. You can also do a full CBC to have a look if there is neutropenia or degenerative left shift. This is, I think, important in the more severely affected dogs. Serum chemistry can help to rule out extraintestinal causes. Electrolytes can help. And also pancreatic lipases can be something that makes sense to see if there are comorbidities like pancreatitis in these dogs. And fecal exam to test for endoparasites is something I think that makes sense in affected dogs with diarrhea that are puppies, so the young ones. In the adult dogs, I think intestinal endoparasites are not playing the role. I think most of the time you can maybe skip that test because it's negative at all, or it's not the cause of the disease in the older ones, but in the puppies, this is something I would do. Urine-specific gravity is something that I mentioned here as well to assess hydration status. And for example, in dogs that are acutemic and have diarrhea, this helps to distinguish only pre-renal cause of the acutemia with the dehydration from a real renal acutemia. When it comes to imaging, I would suggest that abdominal ultrasound is the superior imaging techniques in these dogs, because with this one you can evaluate the intestine and the gastrointestinal tract in detail when you want to do that. Other more exotic but also important add-ons are parvovirosis antigen testing, and sometimes also blood culture is something that I add. Parvovirosis antigen testing is something that we would recommend in puppies, in dogs with neutropenia that are not vaccinated, plus minus have hemorrhagic diarrhea. And the blood culture is something that I think is reserved to dogs also that have risk of sepsis or have hints of a sepsis, like fever, neutropenia, or degenerative left shift. Then a fecal culture, fecal bacterial culture, something that I almost never do in these dogs, because we see that most of the enteropathogens that you test in these fecal bacterial cultures, most of them do not play a role in dogs and do not cause any disease. And moreover, it's also complicated to evaluate the results of a bacterial culture, because some of these classic enteropathogens, they are part of the normal intestinal microbiota. Like, for example, hemolytic E. coli is something that you almost in every healthy microbiome you can find, or also Clostridium perfringens is something that you can find also in every normal dog. So bacterial culture of the stool is something that I do not do. Then this was about diagnostic tests, coming now to the treatment of the patients, and now the interesting part about the antimicrobials. So in our Innovat guideline panel, we ask ourselves in the beginning, when we started with the project, we ask ourselves the question, does antimicrobial treatment have an effect in dogs with acute diarrhea? And to answer this question and to then later form the guidelines, we went first into the literature and did a literature search and screened many publications, and found 6 randomized controlled trials that can answer this question. So these are 6 trials that are placebo-controlled, and when you put all the dogs in these 6 trials together, you have 225 dogs in these 6 studies, which is a relatively high number for veterinary research. And we pooled all the 6 studies together to answer this question. One study was about dogs with mild non-hemorrhagic diarrhea, one study about dogs with hematochezia. There were 2 studies out there with mildly and moderately affected dogs, and there were also 2 studies out about dogs with acute hemorrhagic diarrhea syndrome. The antimicrobials that these colleagues of the studies tested against the placebo were the well-known metronidazole and also amoxicillin clavulanic acid that were used in the studies. And as I told you, we pooled all the studies together and did meta-analysis of all these 225 dogs together to answer our questions on the effect of the antimicrobials on the acute diarrhea. The first thing that we looked into was the duration of the diarrhea. I think this is the most important thing for the owner, that they want the diarrhea to go away as early as or as fast as possible. And in all the dogs of all the studies together, we found out that when they were only treated with a placebo, the diarrhea lasted for 4.5 days. So 4.5 days, some a little bit stopped a little bit earlier, some a little bit later, but around 4.5 days, the dogs had diarrhea. And then in the dogs that were treated with antimicrobials, so metronidazole or amoxicillin clavulanic acid, the diarrhea stopped earlier, but only 0.29 days earlier. And 0.29 days are a few hours earlier. And to be honest, this is not clinical relevant. So we can say, okay, antimicrobials have no effect on the duration of the diarrhea in these dogs. Then going on to disease progression. This is a topic that is for us as veterinarians, I think, very important, because we don't want our patients to get worse during our treatment, right? And we also looked at this in the 6 studies and did a meta-analysis of this. And when you translate our results into normal words, you can say that 21 dogs that were treated with placebo versus 0 dogs that were treated with antimicrobials per 1,000 dogs with diarrhea affected got worse with their disease. So there is no clinical relevant difference between 29 and 0 per 1,000, I think. And going on with mortality, I think this is also very important. For example, in the acute hemorrhagic diarrhea syndrome dogs, we don't want the dogs to die. And there we also looked into the studies, and we saw that in the dogs that were treated with placebo, 21 dogs per 1,000 dogs affected died, versus in the antimicrobial treated group, 30 dogs per 1,000 dogs affected died. So no difference in mortality when you treat the dogs with antimicrobials versus not. Adverse effects is also something that we care about. Happily, there were no clinical side effects of the antimicrobials in the dogs, so this is important. But we have for sure other effects of antimicrobials in our patients. And one study had a look in the proportion of resistant bacteria in the dogs that were treated with antimicrobials. And there was for sure a huge increase in the proportion of resistant bacteria in the individuals that were treated with antibacterials. And this lasted also over weeks after discontinuing the antibiotic. So I think this is also something that you have to keep in mind. Another last thing that we care about is the duration of hospitalization, because that means money for the owner. And in the dogs of the studies where the dogs were hospitalized, we saw that the dogs treated with placebo stayed in the hospital for 3.3 days, whereas the dogs treated with antimicrobials stayed for 0.37 days longer, which is also no difference. So duration of hospitalization did not increase when you're treating them with placebos. So when we're going back to the question, is the treatment with antimicrobials in these dogs recommended? I think with these studies, you could also answer this question by yourself. So in the dogs with mild disease and in the dogs with moderate disease, in which also we can find acute hemorrhagic diarrhea syndrome dogs, the answer is clearly based on the evidence that is out there. No, we should not treat them with antimicrobials. Then in the dogs that are severely affected by the disease, we must say potentially yes, because there are no studies out there describing these dogs, and these dogs are severely affected by the disease. They maybe are life-threatening affected, so there potentially antimicrobials can have a benefit. But as you remember in the beginning, I told you these are only 1% of our patients. Which antimicrobials should I then use in the severely affected dogs? So we would recommend parenteral usage and preferable intravenous usage of the antimicrobials. And we should use antimicrobials that are expected to be effective for the prevention and the treatment of a bacterial translocation. So in these dogs, we do not treat diarrhea with the antimicrobial, we treat the potential sepsis, risk of sepsis. And the first line antibiotic that we would recommend in this patient is a beta-lactam. And when you don't have that available, maybe sulfonamides can also work, but a beta-lactam like ampicillin or amoxicillin clavulanic acid is the first line antibiotic that we would recommend in this patient. In dogs with really life-threatening conditions or dogs that are not responding to the first choice antimicrobials and supportive care, you can use four-quadrant antimicrobial therapy. So then you can combine, for example, the aminopenicillins, the amoxicillin, clavulanic acid with, for example, a fluoroquinolone to have a more broader antimicrobial spectrum addressed. But this is only reserved to the dogs that are not responding. Another question that comes up is how long should we treat these dogs with antimicrobials? And here from retrospective studies, we know that a shorter duration is enough for these patients. So we would recommend to use a shorter duration of antimicrobial treatment. 7 days or less is, in our opinion, enough for most of these dogs. Okay, so we have an idea about the indications of antimicrobials in these dogs. Then what you learned is that in most of the patients, it's not necessary to use antimicrobials. But I think for the owners and also for us, it is important to give them maybe other options, how the owners get the feeling that they can treat the dog with something that is good for them. And there, I think diet is a big player. So almost every dog got a dietary modulation for me. So there are out there highly digestible diets. Fiber supplementation is maybe something that is a good idea in some of the patients, like adding psyllium or cellulose. But I think there are other talks here that can give more ideas on that. But I only want to say this is a huge player in the treatment for me as well. Other treatment options that you can consider in these patients are options that can treat other clinical signs, like when the dog has nausea, vomiting, then I use antiemetics, and analgesia is something that is maybe also in many patients a good idea. In Europe, we can use metamizole in the patients, but also low-dose opioids like buprenorphine is something that you can use in hospitalized patients, for example. Then another topic are the probiotics, because I can think many of you use probiotics in your clinical practice. And also Innovat has a section about the probiotic use in acute diarrhea in our guidelines. We also searched here the literature about the usage of probiotics in placebo-controlled trials, and we found 5 studies that describe the usage of different probiotics in acute diarrhea in dogs. And 4 of these 5 studies, so most of the studies, showed no clinical relevant effect of the probiotic on the duration of the diarrhea. And there was only 1 study out there that showed an effect on the duration of the diarrhea or shortened the duration, but most of the studies did not. But I must say that most probiotics do not harm our dogs. So it is not harming the dogs when you use probiotics. So the Innovat panel decides that we do not recommend for or against the use of probiotics in these dogs, because when you have the feeling maybe to give them something good, then probiotics is an okay option. But we must say there is no evidence that there is a clinically relevant effect of them in acute diarrhea. Other treatment options, one is rehydration. This is the key in acute hemorrhagic diarrhea syndrome, for example. You must give them the fluid losses back that they lost over the diarrhea. So infusion therapy is the key in this patient. So this is also very important. And here is a picture that I want to show you. This is a patient of mine in Munich years ago with a rectal catheter with acute hemorrhagic diarrhea, and you can see the huge amount of fluid that they lose over their hemorrhagic diarrhea. So in these patients, fluids infusion, intravenous fluid infusion is the key. And in most of these patients, as you learned, antimicrobials are not needed anymore. So when I try to conclude what I said, I think we are very clear that there is no evidence out there that antimicrobials are effective in treating the diarrhea itself. But in dogs with sepsis, risk of sepsis, so dogs that are severely affected by the disease, antimicrobials are recommended by the ENOVAT, but these are only 1% of the overall population of dogs with acute diarrhea. And in these dogs, it's also important to notice that in these dogs, the goal of the antibiotic treatment is not to treat the diarrhea, but to treat the systemic bacteremia. And we know from the studies that it takes time until diarrhea stops. It takes around 4 to 5 to 6 days in these dogs. With placebo, with antimicrobials, it doesn't matter. We have to be patient with these dogs. And one last thing that I want to show you, this is a Facebook post of a veterinarian, and she or he allowed us to show you these lines. And one of the Purina people gave me this once. And there's one veterinarian that's saying, I'm getting so many angry clients over this whole metronidazole thing. And I want to skip now a few sentences. But in the end, they say, after all standard things have failed and they are still having diarrhea after 5 days later, how does Metro fix it so fast? So you can see that they are really frustrated with the whole diarrhea thing. But after this talk, I think you can answer this post very well, because 5 days is something that the diarrhea can last anyway. So I think sometimes the owners are getting back after 5 days to you and you have the feeling you have to react. Then you maybe sometimes overact and overused in antibiotics, and diarrhea would go away anyway also without them about 5 to 6 days. So I think that this is the answer for the question why the Metro is working so good, because when you introduce it after 5 days, then it works, but actually diarrhea would go away after this time. Okay, so I hope that I introduce you some new thoughts, and want to thank the Purina Institute for the opportunity to talk here, and open for questions.